Micah, thank you very much. And Laura, first, welcome to everybody. We were taking bets on whether without the beer there would be a substantial showing. I was guessing about 12 or 14 people would show up, so I'm delighted to see that we're well over 100. So thanks for joining us. Thanks also, of course, to Laura for the technical support, Micah and John and the rest of the Science on Tap group for extending the invitation and for carrying forward a tradition. I think it is very important that we all find some ways to stay connected while we keep our social distance. Today, I thought we'd do two things. First, some of you may have joined the radiology department town hall. I'm guessing perhaps some others didn't, so I thought I would give a very quick kind of rundown of what I talked about at that town hall today, some things I learned from that. And then quickly move on to our very special speaker who I'll introduce for a little bit of a discussion in just a minute. So at the town hall today, Dr. Brink, our chairman, went through all the kind of key operational and clinical departments within radiology and talked about the status of the department. As you can imagine, while some elements of the hospital, of course, are very busy, many elective procedures have been appropriately deferred, and that has had an interesting and quite significant impact on the Department of Radiology. We are down something on the order of 70%, down to about 30% of our typical volume, which reflects the nature of the kind of work that we tend to do. Of those studies that we're still doing, of course, chest x-rays are a dominant part, chest CT, and a variety of other emergency type procedures. But the department is certainly kind of dealing with the challenge of both how to deploy their workforce broadly and finding other ways to use the physician workforce to try to help during the crisis because there frankly just aren't that many radiographs to read. Regarding the shutdown, I just want to thank everybody that's on here, and of course many that may not be on, for the tremendous work that we did as a community to get ourselves shut down. I mean, there are more than 300 people in the Martinos Center. We had, really less than a week to try to organize ourselves to be working effectively from home. Shout outs to Sam Mayer and Paul Raines and others in the technical group who helped make that happen. And to everybody in each individual lab that managed to quickly organize themselves so that working from home was something that was feasible. Obviously, there's a lot we can't do, but there's plenty we can do. And I know, having spoken to a bunch of you, that grants are happening. I just sent around a notice to the faculty about an announcement of, I think there's $60 million more coming into NIBIB for COVID-related supplements. There'll be other opportunities for us to contribute our minds and our research efforts for this crisis and, of course, for future research. So be on the lookout for that. I'll also give a shout out, of course, by Murphy's Law, right after we had everybody had left. Sure enough, one of the magnets, cold heads, decided to break down. Chris and Jerry quickly did a cold head transplant. Moved it from one of Jerry's magnets, which he graciously took down so we could save the 4.7. So it's back up and running, if I understand properly, safely, which is great. And thanks to them under emergency circumstances to get that going. Regarding this issue of redeployment, as all of you should have been approached by your managers, your supervisors, your PIs, the hospital has asked all managers to be able to fill out some simple information about the potential for all employees in the hospital to be redeployed, and the research community is no different from that. Of course, if you're doing important research, that's a reason to stay at it. It's a discussion you should have with your managers. But if there are opportunities for you to volunteer, you should consider doing so. And in fact, that'll be the topic of our discussion in just a little bit. I will also say on that point, there was a specific call out for translators. I think you've all heard this before. Something like 70% of our faculty and staff and fellows come from overseas, were born outside the US. So we have a lot of language skills within the center. And there seems to be a need for those. So look up those opportunities. And if you are able to volunteer, that would be great. Sounds like the institution can use it. Finally, there's been lots of interesting activity in using the engineering and scientific expertise of the entire institution. They've actually stood up very quickly a new center for COVID innovations that's led by Gary Tierney. Gary is a optical imager, a colleague of ours from the Wellman Center. Apparently, they've received more than 1,000 ideas at this point, so just even going through them and vetting them has been quite a task, but he and a large number of people have been contributing to that, including, of course, people in our own lab. Larry Wald and Jason Stockman have been helping join a work group on devices and using 3D printers to help design devices. Some of you may remember our colleague Elizabeth Hillman from Columbia. She's now working with two other members of radiology, Mark Suki and Mark Otismeyer, in developing a very efficient, something like a 24-cent face mask, because face masks are getting in short supply, as my own daughter, who's a nurse on Ellison 18, was telling me. So if you have ideas, please go to that website. I think it's COVID_innovations, and contribute our ideas, contribute to a work group, get involved in those activities. There's a lot of opportunities, I think, for people to help out. There's also, of course, activity in other domains. Data science is another one of the topics that people have come up with. Our own Jayashree Kalpathy Kramer is actually involved in two projects. One of them, a really interesting one that she's taken the lead on, is developing something which is, as of today, I think is called the MGH Community Help, but I think it's pretty quickly going to become Partners Community Help. And maybe we'll have her presented at, at the next Science on Tap, but it's a very cool, web-based map that allows people to ask for help and to contribute or offer help based on their local neighborhoods. And so I think the idea is to find ways to get the partners community to help each other locally, do whether it's walking a dog or getting groceries, what have you. So I shall be standing that up officially, I think, in the next few days. I'll make sure everybody hears about that. But check that out. If you need some help, ask for it and use that tool. If you can contribute help, even better, please go and do so. Well, okay, so with that kind of as a background in terms of where the department is, I thought I would circle back to one of the points that we talked about earlier, and that's this notion of redeployment. There has not been, to the best of my knowledge, kind of action, centrally from the administration to take the work lists that we're handing them to take our workers and actively redeploy them. However, it's also true that people, they've been looking for volunteers, and I'm very proud that the very first such redeployed volunteer in the Department of Radiology was our own colleague, Bruce Jenkins. So maybe, Bruce, we can ask you to join us on this chat, and we can talk a little bit about how it's been going so far. There he is.
Yeah.
Bruce, looking safe and sound. How are you?
Good.
So I was hoping we were going to get you literally from the front lines, but I take it you're not on call as we speak.
No, actually, I did get a phone call though, so I guess I'm going to have another shift. But the shifts are, they come and go. So I think the important thing to know is that it is voluntary for those of us who are working at home. For a lot of the hourly employees, it isn't really voluntary, because if they are asked to be redeployed to the hospital for some other work and they refuse, they will lose their vacation time, their accrued time. So for some of those people. And when I was doing my shift, it was mostly with those types of people.
So Bruce, that means that if you're volunteering, basically somebody that might not choose to be there, might have some reasons not to be there, you know, family to take care of, whatever. You're actually, you know, allowing them to stay and help out at home while you step in.
Yeah, that would be the best case scenario. Sure, they got the sick grandma at home, they have to take care of her. Or you got, you know, your single mom with 3 kids at home, you got to corral during the day. Yeah, that would be one thing. When I filled in the sheet, you know, they asked everybody for these, before the sheet that was sent around by the Martinos Center that had the bug. I don't know if you found the bug about the PI number, but the hospital had asked for a spreadsheet and had special skills. And so I was trying to figure out what my special skills were aside from.
So Bruce, given your like extensive training in brain physiology, I assume they assigned you to work in the neurointensive care unit, or maybe running, you know, the ventilators as they've become oversubscribed on ventilator patients. So what did they actually put you to do?
Well, I guess if you want to be generous, to use my it was behavioral modification therapy. So the idea was, as we were walking in the hospital, we were supposed to make sure that before they entered the corridors that they had their masks. So I had to give out, we have to lay the masks down. When all the masks are gone, you have to wipe down the counters with disinfectant. Every time somebody puts their bag down to put on their mask, you had to, you know, use disinfectant. And we had to make sure that everybody had their masks on, which was mostly, most people were compliant with that. And apparently, though, the day before, a number of MGH employees had stolen a bunch of masks and had to be chased out of the building by security and forced to give up the masks, which were then thrown away because they had all been touched. So, and there is actually a shortage of masks that have the elastic bands. So they may have to go to the tie masks, which are much more inefficient to put on. They don't hold on as well as people are putting down all their bags while they're putting them on, so there's more chance for you know, infection. So we had to, during one point I have to stand by the entrance to the white lobby, and as people go through, you have to make sure they've got the steel band on top of your nose, and then it goes tucked under your chin. And you know, so obviously it was somewhat dull, but they did actually, what's nice about it is, at the end of the shift, they gave us taser guns. So anybody who doesn't have a mask, we're allowed to taser as they go in. And you know, I'd never had a chance to use a taser gun, so that was actually kind of fun. But actually, they didn't give us a taser gun.
Yeah. So
they do, though. They gave us these very long, sharp sticks with a little metal object on the end, which is a chromatic reading device. And this allows you to keep your 6-foot distance. And if the tip turns red, you know that the person's gotten too close. So anyway, that is.
So what's it like to tell a busy cardiac surgeon, you know, how to put on his mask?
Well, honestly, most of the people who look like doctors, you know, in other words, they're wearing scrubs, or I could see that they had the MD on their badge, they were actually fairly compliant. It was a lot of the other people who were not compliant. And so, that, you know, that is actually very in line with what surveys have shown, which is that the more educated you are, the more seriously you take it, and the more likely you are to adhere to the rules that the CDC has put out for, you know, whereas the less educated you are, the more likely you are to gather in groups and et cetera, et cetera. But in any case, most people overall were very compliant. There was no one who was verbally abusive. There were a few who were like, you know, disgruntled, I should say, at being forced to not be able to enter without putting their masks on.
Tell me, are you wearing a mask during the whole?
Oh yeah, you have to. Of course, yes, you have to wear a mask.
What's it like to be in a mask for a 4-hour shift?
Well, I call it the bad breath recirculation device, which is actually after a while you don't even notice how bad your breath is. But no, it's
any advice for people when they find themselves in this situation?
Yeah, just don't do anything that will make you sweat too much. But no, I think it's not real. I didn't find it onerous at all. It was perfectly fine. What they did say, I was talking to HR. So right now, I think that HR is there trying to figure out how to redeploy people most efficiently. And I can say that I think in the beginning stages here, they have not done it very efficiently. We were overstaffed, but I think that they also said they're going to try and start to filter down to maybe different skill sets. So whatever I listed as my skill sets, that maybe they would give me jobs that were more commensurate with the particular skill set that I had. But that is yet to be.
Make it to the neuro ICU yet then?
Yeah, right. Yeah, I don't know. You know, what skills? I can tell jokes. I don't know if you guys heard what happened in Finland. They closed down all their borders, and now nobody can cross the finish line. So in any case, it's a good thing to do because they're going to need people.
Good thing you get no feedback on the deathly science that these jokes generate, Bruce.
Right, exactly. Which is probably a good thing because it's easier to think that everybody's laughing rather than think you're being greeted by a wall of stony faces. But
what would you say the mood? What would you say the mood is like in general? Is people coming on the shifts and leaving?
Very businesslike. It didn't seem like there was a lot of levity. I mean, compared to say, usually when people are getting off their shifts, you see them, they're kind of laughing and gabbing. And there was some talking going on, but I think there's an overall somber mood. I sense that in people. I think people are easier to anger. But I will say that people do seem to be maintaining social distance. And I think most people, like I said, the compliance rate was very high for the masks. Most people were willing to put them on. And I think that as we go through this, you know, your risk of exposure. So one of the things that you might have been worried about was, you know, are you risking being exposed at the hospital? And of course, you know, who's going to the hospital? It's sick people. And it probably is a legitimate risk on your part. But if you look at the projections, you know, for the epidemiologists have made, it's what about 50% of the people are going to get infected anyway. So, you know, I wouldn't let that dissuade you because you will have your mask on, you will maintain social distancing. You're constantly, you know, using hand sanitizer. So
for those interested in that, there was quite a good article that came out from Athinoula Gawande in a recent New Yorker talking about keeping our healthcare workers safe. He actually said something very interesting, a couple interesting things. First, in China, of course, during the initial wave, a very high percentage of the healthcare workers were getting sick. But once they, you know, kind of understood what they were dealing with, they ended up bringing in healthcare workers from outside. Apparently, none of them ended up getting sick. Now, in that case, they really used, you know, tremendous measures, kind of full hazmat suits, whatever. But, you know, it does show first that, you know, it's not inevitable that healthcare workers get sick. The other thing he talked about was the fact that in countries like Hong Kong and Singapore, that just kind of using, you know, some kind of common sense in terms of how they follow up their healthcare workers, who can go on furlough, who needs, you know, or quarantine, who can, you know, just kind of self-monitor, actually made a very big difference in keeping their healthcare workers safe. And even without going to the full hazmat suits that they were doing in Wuhan, they really dropped their rate of infection of their healthcare workers quite low. And it does seem like our own OC Health is kind of following along those same guidelines as have emerged from places like Singapore and Hong Kong. So,
right.
You know,
and South Korea was very
not necessarily inevitable. You know, that at least that our healthcare workers will fare worse than the general population.
Right.
Did you feel safe? Do you feel safe when you're there?
I mean, I feel as safe as I would have felt in the supermarket, or perhaps more so, because at least everybody was wearing a mask.
Yeah.
And I wasn't standing too. I tried to maintain, you know, social distance, and also, you know, most people were cognizant of the risks, and so I think you were probably safer than you are at the supermarket for that particular job. Now, one of the things that is good if you want to volunteer is that, especially for people like us who have work to do at home, we get data analyzed, papers to write, you know, papers to review, etc. You can take kind of any shift you want. So they have shifts that go all the way, you know, at all hours of the day. So I have been volunteering for 4-hour shifts. So, you know, then you leave the house at 5 o'clock, get there at 5:30. And it's really a very, you know, it's not onerous in the least, and it gets you out of the house. But yeah, you know, if you're one of those, if you're a germaphobe, you're probably not going to like doing any kind of volunteer work that doesn't involve something that allows you to stay at home. Maybe if we really do reach a real crisis in the city of Boston where the number of beds will be completely taxed and where we won't have enough ventilators and they're completely slammed, maybe then there will be other types of jobs that we'll be able to do that maybe would require our backgrounds. Most of us who have backgrounds in at least, basic physiology and I don't know though. I mean, it all depends on how bad things get.
Let's hope it doesn't come to that.
Yeah.
So let me ask one final question, always a very dangerous one when talking to you, Bruce. Any further thoughts that you want to share with the group?
No, I just think that I think all of us should be really empathetic to the hourly workers who really kind of have to do this. So they're kind of required to be there. And to all the other people in our lives who don't have a salary, who are being paid hourly, whether they're working in a restaurant, doing contracting work, or some of our hourly employees in the hospital itself. So I would just I would ask that you just be sympathetic to those people and so when I was talking to Bruce earlier before this, he's the one that brought up the point about by us volunteering for tasks that certainly not commensurate with our education level, you are perhaps freeing up someone who might actually not want to use their accrued time. Like one of the women I was talking to was really worried about losing her vacation time in the summer, and she's worried she might lose her job. So at Mass General, if this persists, because she works in the dental office, and right now they've shut down completely. So I think we should all just be a little sympathetic.
Excellent point. So Laura, are there questions that you think we should address, or we're certainly over our usual 10 or 15 minutes for Science on Tap, but I know I'm certainly happy to hang around for a few minutes, perhaps Bruce is as well. Or not.
Micah, there you are. Do you want to take control of the questions that came in?
Sure. I was already thinking about how can I interrupt these guys with these questions.
You're good.
No, just joking. No, Jacob asked, are the masks only for the staff or also for the patients when they enter the hospital?
So no, that's one of the problems is there aren't enough masks. So the patients are not being given masks. And as a matter of fact, the shuttle bus drivers are being asked to wear the same mask for the entire day, or at least during their shift.
As so nurses.
Yeah. Wonderful. So most employees, when they come in, are given a new mask, but that's kind of, they are limiting the number of masks right now.
Okay, so that's disturbing, I guess. And then another one is, what kind of skills did you check for when you filled the redeployment forms?
I just told them I was, a scientist. My main skill is, reviewing grants and, I put down, brain imaging. I thought if it gets really bad, if the MRI techs are trained in CPR, at least they could have somebody who could I can run a scanner, that kind of stuff. So I put down, all of my scientific skills that I had. I can do Spanish and French, so I put down I can do that, and I said, I can tell a few jokes, so I'm good at that. But other than that, so those are the skills I put down. So whatever my scientific skills are, not specific like MR spectroscopy expert or something like that, but more like general, brain imaging, physiology. I've been doing, I've done a lot of anesthesia in animals for years during the scanning, so I know a lot about that. But none of that, of course, I'm not qualified, quote, quote, with the, certifications, degrees, whatever, to be a medical practitioner. But like I said, if things got really bad, maybe they would, start using. I know, like in Italy, they were taking medical students and just putting them into the wards without actually getting their medical degrees because they were so strapped for personnel. So if it gets to that.
I think in New York, excuse me to interrupt, Bruce, but didn't they graduate one of the medical school classes early so that they could get them into the front lines?
Yeah. So, yeah.
No, I
so I think a lot of us, who see patients, who scan patients, and who've done that for years and years. Even if your mainly expertise is writing code or whatever, there's certainly things that we could contribute if it really got desperate. Let's hope it doesn't, and they'll just need me to hand out masks, I guess.
I will say, just add to that, of course, the clinical service is having these same discussions that we are. And they've made the decision that anybody within 5 years of their, medical training and internship, or maybe it's 4 years, but basically anybody who's completed their training recently is kind of skilled enough, or at least their skills are not so rusty that they are redeployable. And some of them have indeed already been redeployed to active wards. And of course, because the radiologists, our workload is frankly down from usual levels, the radiology residents, interventional fellows, et cetera, those that are close to their active medical training and who have experience that have already been redeployed to the front lines. And that will probably continue for some time. They're pitching in as well.
I mean, if they were to let us redesign the whole system, I'm sure a lot of us would have ways of doing data analysis for all of the physiologic monitoring that goes in, and figure out how to best isolate people, things like that. I mean, I'm sure there's a lot of things we could do with the proper amount of time, but there's not enough time probably.
Maybe we'll actually be a little thoughtful and start thinking about doing those things now for the next pandemic.
Right, exactly. Yeah.
Mike,
Most of us are really good at data analysis, right? Because I think everybody here does a lot of data analysis. And so I think those types of approaches, I think a lot of people use machine learning. I think there's a lot that can be done with that type of stuff to be able to make the hospital a safer place, perhaps.
Absolutely.
Anyway, whatever.
Other questions?
Yeah, there were not a few other questions. From Jacob again, but it was more like they're making hand sanitizers for locations, and we might be able to do that too. That was his question, and the radio left.
Yeah.
Are you talking about radio-labeled hand sanitizers?
Yeah, hopefully
Actually,
not. But
I apologize. I meant to bring this up when I was talking about our innovations. Dan Yokel, who runs the radio pharmacy over on the main campus, actually turned some part of that radio pharmacy into a hand sanitizer production facility, very impressively and really usefully. So that's going on. He's generating thousands of bottles of hand sanitizer for the department and elsewhere. And Jacob, you may want to reach out to him to see whether there's some opportunity for us to follow suit. I'm glad you raised that question. First, a shout out to Dan. That was a great public service. And second, maybe we can contribute.
Yeah.
And this question was also if we already researched our own supplies for PPE in the Martinos Center that we could donate to physicians and nurses and staff over there at the main campus.
There are certainly is a means by which people can donate. I know Bruce Fischel, through some neighborhood activity in his neighborhood in Cambridge, had some masks that they've looked into donating. There is, I don't recall it off the top of my head, but there is a website that you can write to and say if you have access to things that you can donate. Of course, the challenge is they need to make sure that it's the proper equipment. What's worse than not having an N95 is having one that actually doesn't work, because it's not of a sufficient quantity, but then you think you're protected and you're not. There's fairly high bar when they're taking in materials from the outside. They need to understand the provenance of it. But having said that, there certainly are ways to contribute, and I think people are very much open to that. On the same front, I know a lot of activity thinking about how to re-sterilize things like masks and face protection. The best methods, it's one of the domains that is very much a topic of this COVID innovation group that Gary Tierney is working on. The challenge is not just to have a good idea, but then to have a good idea for how you validate that what you did actually works. It's a tricky process, but one that people are working on. And please, if you have ideas there, jump onto that website and get involved in one of those work groups.
What is that website again?
I think it's COVID_innovation@partners.org.
Okay.
But, if it's not exactly that, I'll try to make sure I get it right and share it around.
We'll just Google it, yeah.
Yep.
No, there are plenty of, I see plenty of questions coming through, but I guess I'll just ask the last one because we're already, it's 4:30 now, to wrap it up a little bit, if you guys are okay with that. The question, it's a tough one. I don't know if you know the answer to that one though, but if visa holders are there any compliances things that they have to think about when they get redeployed, or are they able to be redeployed?
Well, it's an interesting question. I'm sure I don't know the official answer. I would be very surprised if there weren't a way to protect, our visa holders as they may be deployed, but they're still working within the Mass General Hospital. And so their at least place of employment hasn't changed. But I will take that question forward and try to get a more definitive answer and share it with any folks that know. But at this point, certainly my intuition is that because you'd still be working at the MGH, it wouldn't be an issue. But I'll double check on that. It's a good question.
Okay, thank you. That was Christine Sanders, but I'm on a visa too, and I think plenty of people in this are. So
let's try to get a better answer than the one I just gave, a more definitive one.
Great, thank you. Yeah, so I want to thank you both for taking the time to answer some questions. I know there's a lot of questions still popping up. I guess, is there anywhere they can address that to within the Martinos Center?
Sure. Maybe use this team, the team's website, or, the team's process that, Jacob and others have set up. Maybe Jacob even wants to weigh in on how we could use that as a forum to begin to post these questions and then get some answers to them. It's a good idea.
Yeah, that would be great. I'll reach out to Jacob to set something up on that.
Yeah, let's
set
something up, and that'll give me something to do when I finish my regular emails. I'll have more questions to try to answer. No, I'm actually very happy to do that. I know these are important questions, and very happy to help. And frankly, as another question, if people find we should certainly continue to do the Science on Tap. But aside from that, if people think it would be valuable to have another kind of town hall just for the center, give me some feedback or give Micah some feedback on that. We can certainly set up another time for us to have, kind of an open town hall. I know the department, if you're interested, is planning on having these something like twice a week. I think the next one is scheduled for Monday, and then Thursday after that. Everybody here is welcome to join that. But we could certainly organize one, just for ourselves. Frankly, that one is interesting, but it's mostly clinically focused, and it'd be good to have one, focused on our research community. I'd be very happy to participate in that.
Yeah, that would be great.
Bruce, hi, this is Jacob. So I have started inviting people to the team's application, but I sent you a draft announcement for the center broadly. So for those of you on the call now, the Teams, Microsoft Teams application that Bruce just alluded to is something that a small group has been setting up in order to facilitate communication across the center during this time, hopefully beyond. And so look for an email from Bruce over the next day or so to subscribe to it.
Great. And Jacob, do you think that will be a good forum to kind of post and answer some of these questions?
Yeah, I think it'll be a great forum for it. In fact, we've already created a COVID-19 channel specifically for questions related to that. And there are a host of other channels that we expect will spark dialogue beyond the COVID questions that may come up.
Yeah, and I know one of the things I'm keen to see is that at least some part of that, is an opportunity for people to share some of their science. I know many of you, despite your concerns, the challenges of your daily lives, are still actively doing research and making discoveries. It'd be nice to share those with your colleagues. Give us a sense of remembering what our mission here really is about, and keep us excited about the work that we're doing. So we can perhaps use it in that form as well.
Good time to write up all those papers you had sitting on your hard drive that you never quite got around to.
I'm sure everybody's got a list of from 2 to 20 papers, and exactly now is a perfect time to write those papers up. Good time to finish up that IRB. Good time to cull through the NIH RFAs. There are a bunch out there. For sure, it's frustrating not to be able to collect data, but there's plenty of good stuff to do even without collecting new data.
Do you know, are the, can I ask one question before we go?
Yeah,
Yeah,
you
of
are a
course.
special guest, so you get the last.
Are they still meeting to review IRBs and IACOC applications?
I believe they are. I don't know for sure, but I think that they're trying as hard as they can to kind of keep business as usual. So
Okay.
at least I haven't heard they shut it down. I'll try to get you back with a definitive answer, but yep, good time to get those written up. At least get in the top of the queue for when they do open up again. But I think they are. I'll make a final comment. I mean, sometimes you know, we butt heads with the central administration, Harry Orff and Gary Smith and those guys about this, that, and the other thing. Plenty of challenges in working in a complex system like ours. But I will say, you know, those guys have worked tirelessly on this crisis. You know, I think they probably slept, you know, 10 hours between the two of them over the last week. You know, an inordinate amount of coordination to try to organize the shutdown, these redeployment issues, get everybody set who needs to be in. So they're really working hard, and it's a good time to support them in any ways that we can. Okay, all. Well, listen, thank you very much, Micah, John, Laura. Again, thank you guys so much for organizing this. We'll look forward to more of these in the future, and I'll look forward to a chance to answer some of your questions or see that they get answered on the channel that Jacob sets up through the Microsoft Teams app.
Yes, thank you very much. And well, happy Friday, everyone. Enjoy.
Go have